Hello guys, welcome to my channel. In this video, we are going to see about the Flexor Retinoculum. So before going into the topic proper, let me mention you what all the topics that we are gonna cover in this video. The topics are the attachments of the Flexor Retinoculum, both medial as well as lateral, and the relations of the Flexor Retinoculum, that is the structures passing deep to the retinoculum and superficial to the retinoculum. First, let us see about the attachments of the Flexor Retinoculum. So what you are seeing here, this is the supine position of the right hand. So this slit, this band, this one is the Flexor Retinoculum. I am going to isolate that. So here you can see this is the Flexor Retinoculum. So what you are seeing here, right here, this is the Flexor Retinoculum. Let us see the attachments one by one. Before seeing the attachments, let me mention you the carpels from the lateral side to medial side. So what you're seeing here, this one is the scaphoid, and here you can see the lunate, and here is the pisiform bone, and this is triquetral bone. And what you're seeing here, this one is the trapezium, and here is trapezoid, and then this is capitate, and here you can see the hamate. So once again I am repeating the carpal bones. So here you can see the scaphoid, then this is lunate, and here you can see the pisiform, and this is the triquetral bone, then the trapezium, trapezoid, capitate and hamate. Coming to the attachment of the Flexor Retinoculum on the medial side. So here you can see the Flexor Retinoculum, it is attached to the pisiform bone as well as to the hook of the hamate. Here you could see the hook of hamate, this is the hook of the hamate. And also here you can see the pisiform bone. So on the medial side, the Flexor Retinoculum, it is attached to the hook of the hamate as well as to the pisiform bone. And on the lateral side, the Flexor Retinoculum, it is attached to the tubercle of the scaphoid. Here you can see the tubercle of the scaphoid and also to the crest of the trapezium. So on the lateral side, the Flexor Retinoculum, it is attached to the tubercle of the scaphoid and to the crest of the trapezium. And another important thing regarding the Flexor Retinoculum. See, this is trapezium, this is trapezoid, this is capitate, and this is hamate. As I already mentioned, medially it is attached to the pisiform bone as well as to the hook of the hamate, and laterally it is attached to the crest of the trapezium. Right. On the lateral side, here you could see a deep slip of the Flexor Retinoculum. It gets attached to the groove on the trapezium so that it makes a tunnel for the tendon of Flexor carpi radialis to pass through. And on the medial side, a superficial slip is attached to the pisiform bone, and this slip, this is called as the ulnar carpal ligament. Under which the ulnar artery and vessels pass through. So once again I am repeating the attachments. So on the medial side, the Flexor Retinoculum, it is attached to the hook of the hamate and as well as to the pisiform bone, and laterally it is attached to the tubercle of the scaphoid and crest of the trapezium. Let me explain you with a clear diagrammatic representation. Right. So see, this is the trapezium, and then it is the trapezoid, and here you could see the capitate, and this is the hamate. Right. I have drawn here only the distal row of the carpal bones, right? So again I am repeating, this is trapezium, trapezoid, capitate and hamate. This is the lateral side and this is the medial side, right? So a thick fibrous band, it is attached medially to the hook of the hamate, and laterally to the crest of the trapezium. And that band is called as the flexor retinaculum. As we already saw, a deep slit, it gets attached to the groove on the trapezium, which makes a tunnel for the tendon of the flexor carpi radialis to pass through, right? So this is the tendon of flexor carpi radialis. And on the medial side, a superficial slip arises and it is attached somewhere to the pisiform bone. In this diagram, pisiform bone is not shown. So a superficial slip arises and is attached to the pisiform bone on the medial side, right? And this superficial slip is called as volar carpal ligament, under which the ulnar nerve and ulnar artery passes through. So as I already mentioned, this is the volar carpal ligament and this is the ulnar nerve from the medial cord of the brachial plexus, and this is the ulnar artery, which is a terminal branch of the brachial artery. Now coming to the relations of the flexor retinoculum. First let us see the structures passing superficial to the flexor retinoculum. So here you can see the hypothenar eminence. So the hypothenar muscles, it arises from the flexor retinaculum on the medial side, right? So this is the hypothenar eminence. And on the lateral side, here you can see the thenar eminence, which consists of the thenar muscles, which also rises from the flexor retinaculum, right? As I already mentioned, the ulnar nerve and ulnar artery, they pass above the flexor retinaculum. They are superficial to the flexor retinaculum but deep to the volar carpal ligament. Then the tendon of the palmaris longus muscle, it passes superficial to the flexor retinaculum. So on the medial side of the tendon of palmaris longus, you could note a nerve that is nothing but the palmar cutaneous branch of the ulnar nerve. And on the lateral side, you could note a nerve that is the palmar cutaneous branch of the median nerve. So on the medial side, it is the palmar cutaneous branch of the ulnar nerve, and on the lateral side you could note the palmar cutaneous branch of the median nerve. Once again, I am repeating the structure superficial to the flexor retinaculum from medial side to the lateral side. See, the structure superficial to the flexor retinaculum are the hypothenar eminence, and then the ulnar nerve, the ulnar artery, then palmar cutaneous branch of the ulnar nerve, and then the tendon of palmaris longus, then palmar cutaneous branch of the median nerve, then the thenar eminence. These are all the structures that are superficial to the flexor retinaculum. Now let us see the structures passing deep to the flexor retinaculum. Let me mention you the structures deep to the flexor retinaculum from the medial side to the lateral side, right? The first structure is the ulnar bursa. Deep to this ulnar bursa only, the tendons of the flexor digitorum superficialis and flexor digitorum profundus lies. The tendons lying in the upper portion of the ulnar bursa or the tendons of the flexor digitorum superficialis, and those lying in the lower portion or the tendons of flexor digitorum profundus. Once again I am repeating, so these are the tendons of flexor digitorum superficialis and these are the tendons of the flexor digitorum profundus. Then here you could see the median nerve. This also lies deep to the flexor retinaculum. And here you could see another bursa called the radial bursa. This is the radial bursa within which another tendon lies, which is the tendon of flexor pollicis longus. So the tendon of flexor pollicis lies within the radial bursa. So once again I am repeating, see, this is the radial bursa within which the tendon of flexor pollicis longus lies. As I already mentioned, the flexor carpi radialis, the tendon of flexor carpi radialis, it lies deep to the flexor retinaculum within the tunnel which is made by the deep slip of the flexor retinaculum, which is attached to the groove on the trapezium. Let us again see the structures passing deep to the flexor retinaculum from the medial side to the lateral side. So the first structure is the ulnar bursa, within which lies the tendons of the flexor digitorum superficialis and the tendons of flexor digitorum profundus. Then the median nerve also lies deep to the flexor retinaculum. Then the radial bursa within which the tendon of the flexor pollicis longus lies, and then the tendon of flexor carpi radialis within the tunnel made by the deep slip of the flexor retinaculum attached to the groove on the trapezium.